Hi, so what we're going to have a look at now are the thoracic vertebra. So we've looked at a typical cervical vertebra, and now we're going to have a look at a typical thoracic vertebra. Now, the challenge with looking at the thoracic vertebra, of course, is that they have an attachment for the ribs, and it's difficult to sort of show all the features of a thoracic vertebra if we were to have the ribs attached. So I've used complete anatomy here to isolate a single vertebra, a single typical thoracic vertebra, and we're just going to talk through some of the features of the bone itself. So if we look at the body of a typical thoracic vertebra is roughly heart-shaped, and its measurements from side to side and front to back are roughly equal. Now, the anterior and the lateral sides of the body are convex, but the posterior surface is concave. Now, the upper vertebra, the upper thoracic vertebra, are rather more oval than those in the middle, where they are more elliptical in shape, almost resembling the bodies of a lumbar vertebra. Okay, so the sort of upper thoracic vertebra tend to have oval-shaped bodies, and then the very lower thoracic vertebra have bodies resembling that of the lumbar spine, but in the sort of mid-region of the thoracic spine, they have this generally roughly heart-shaped body. Now, on the upper and lower margins of the lateral sides of the body and close to the root of the pedicles are demifacets, which together with the demifacet on the body of the vertebra above and below form an articular facet for articulation with the head of a rib. Okay, so we can see there those demifacets, okay, which are on the root of the pedicles there, the broad bands of bone which project back from the body of the vertebra. Okay, so we've got a roughly, generally the thoracic vertebra are heart-shaped body, but the upper thoracic vertebra sometimes are more oval, and the lower thoracic vertebra can sometimes be more like a lumbar spine. But generally, if you're going to describe them as heart-shaped body. Okay, convex anterior and lateral sides and a concave posterior border of the body. On the pedicles, or at the point at which the pedicles arise from the body, we can see those demifacets, and those demifacets form part of the articular surface for the head of a rib. Now, the vertebral arch, let's have a look at the vertebral arch. Remember, that's made of the pedicles and the lamina. Now, the pedicles project directly backwards, and they arise from the upper part of the posterior surface of the body, and therefore the inferior vertebral notch is quite deep. Okay, so the inferior vertebral notch is deep, and that's because the position of the arising of the pedicles. So the pedicles arising from the upper part of the posterior surface of the body, and consequently the inferior notch is much deeper. Now, the lamina are flat, wide bars of bone. If we come around, we can see those very wide bars of bone either side, and the inferior margins overlap with the superior margins of the lamina of the vertebra below, so that the posterior margin of the vertebral canal is closed. In other words, the lamina overlap the vertebral canal as it's going down. Now, the vertebral foramina in the thoracic region is round and is smaller than in the cervical or the lumbar region. Now, let's look at the transverse processes. The transverse processes project backwards and laterally from the junction of the body and the pedicles. On the anterior surface, close to the tip of each transverse process, is a small articular facet which articulates with a facet on the tubercle of the appropriate rib. So we can see the body has facets to articulate with the head of a rib, and the transverse processes have facets which articulate with the tubercle on the rib itself. Let's have a look at the spinous process. The spinous process are long and tapering and project backwards and downwards to a very rough tubercle end. The spinous processes of the middle vertebra of the thoracic spine run more obliquely downwards than those of the upper and lower parts of the thoracic spine. And sometimes the spinous processes of the mid-thoracic region are so oblique that their tips lie opposite the upper surface of the vertebra next but one below. Now, the superior articular processes project upwards from the junctions of the pedicle and the lamina and bear a flat articular facet which faces backwards and slightly laterally. The inferior articular facets or processes are joined to the lateral ends of the lamina, and these articular facets face down forwards and slightly medially.